Okay, picture this. You're looking at your pet's latest lab results, maybe scrolling through them online, and bam, one number jumps out. Potassium. And it's flagged as high. Your mind starts racing, right? What does this mean? Should you be worried sick?
Yeah, it's a common scenario, and it can be really stressful.
Definitely. So that's exactly what we're diving into today. We're going to unpack high potassium. The medical term is hyperkalemia in animals.
Exactly. We've dug into the medical literature on this, and our mission here is to pull out the really crucial stuff for you. We want you to get what hyperkalemia is, why it might happen, what signs to look out for, and maybe what makes an animal more at risk.
But without drowning everyone in super technical jargon.
Right. Focus on the key takeaways, maybe even some surprising bits that stick with you.
Perfect. So let's start right there. What exactly is hyperkalemia? When we see that high number, what are we looking at?
So basically, hyperkalemia just means there's more potassium floating around in the serum, that's the liquid part of the blood, than there normally should be. Generally, labs flag anything over, say, 5.7 milliequivalents per liter or small as high.
Okay, so it's a number above the normal range on the report. Simple enough. But I feel like I've heard that blood tests don't always tell the whole story with potassium.
That's a really critical point. You're absolutely right. The vast majority of potassium in the body, like maybe 98%, isn't actually in the blood at all.
Oh, really? Where is it then?
It's inside the cells. So that blood test, it's just a snapshot, It shows what's circulating right at that moment, but
Yeah.
not the total amount in the body.
Ah, interesting. Okay. So how does that potassium get into the blood in higher amounts? What are the main ways this hyperkalemia thing develops?
Well, there are a few main mechanisms. One big one is called translocation. That's basically potassium moving out of the cells and into the bloodstream.
What makes it do that?
Several things. Cell damage is a major one, like from physical trauma, or if tissues aren't getting enough blood, which is called ischemia. Another key trigger is acidosis. When the body's pH balance is off, it can push potassium out of the cells.
Okay, so cell damage or the body being too acidic can force potassium out. Makes sense. What's another major pathway?
The second big one is the kidneys not getting rid of enough potassium. The kidneys are the main regulators. They filter out the excess. This process is heavily influenced by a hormone called aldosterone.
Aldosterone,
Yeah.
like a manager for potassium disposal.
Kind of, yeah. So if the kidneys themselves aren't working right, think kidney failure, or if there's a blockage stopping urine from leaving the body, potassium can't get out and it builds up. Also, certain medications can mess with aldosterone or kidney function and cause the same problem.
Right. If the disposal system is blocked or slowed down, the levels rise. Okay. Is it possible to just take too much potassium in?
Yes, definitely. It's maybe less common than the other two, but an animal can develop hyperkalemia from getting excessive potassium, either through, food, supplements given by mouth, or even IV fluids if they're not carefully balanced.
Okay, got it. So cell leakage, kidney issues, or too much intake?
Mm.
But you hinted at something else earlier. Pseudo something.
Ah, yes. Pseudohyperkalemia. It literally means false high potassium.
So like a lab mistake or...
Sort of. It's when the blood test says the potassium is high, but it's not actually high inside the animal's body in real time. It's an artifact, usually because of how the blood sample was handled.
How does that happen?
Well, certain blood cells, red blood cells, platelets, even abnormal white blood cells, like in leukemia, are packed with potassium. If the blood sample sits around too long before the serum is separated and tested...
The cells leak the potassium out into the sample.
Exactly. They release their potassium into the liquid part, the serum, artificially bumping up the reading.
Wow, okay. That's super important to know. So a high number isn't automatically panic stations. And you mentioned this happens more in certain breeds.
Yes, that's a fascinating detail. It's seen more often in some East Asian dog breeds, Akitas, Shiba Inus, Jindos, Chinese Shar-Peis. It seems they have a slightly different setup in their red blood cells, a specific sodium-potassium pump that makes them more likely to leak potassium if the blood sample handling is delayed.
Huh. So a tiny genetic difference affects how you need to handle their blood tests.
Pretty much. It's a great example of how subtle breed differences can matter in medicine. So yeah, if you have one of those breeds and get a high potassium result, your vet will definitely consider pseudohyperkalemia and might want to retest very carefully.
Good to know. Okay, shifting gears slightly. If an animal truly has hyperkalemia, what might an owner actually see? What are the signs?
From an owner's perspective, the signs can sometimes be a bit vague, especially early on. Things like general weakness, maybe the animal just seems lethargic, not wanting to move much.
Okay, subtle stuff. Does it get more obvious?
It can, yes. In more severe cases, you might see sudden collapse, or even something called flaccid paralysis, where their muscles become really limp and they can't stand or move properly. And tragically, in the most severe untreated cases, it can be fatal.
Wow, okay. Definitely concerning. And what about the vet? What might they find during an exam?
Besides confirming the owner's observations, the vet will focus heavily on the heart. Listening with a stethoscope, they might pick up arrhythmias, irregular heartbeats. A really common finding with hyperkalemia is a specific type called bradyarrhythmia, which just means the heart rate is abnormally slow.
So it really hits the heart hard. Which body systems are most impacted then? Is mainly cardiovascular?
The cardiovascular system is definitely the primary concern, yes. Potassium plays an absolutely critical role in the heart's electrical system, how the signals that make the heartbeat travel through the muscle. We call that cardiac conduction.
Right, like the wiring.
Exactly. And too much potassium messes with that wiring.
And vets use ECGs, right?
Mhm.
Electrocardiograms. What do those look like when potassium is high?
They do, and the ECG changes can be quite characteristic as potassium levels rise. It often follows a pattern, though not always perfectly.
What's the typical pattern?
Initially, you might see the T waves on the ECG become really tall and spiky, sometimes described as tented. Then, as it gets worse, the QRS complex, that big spike showing the main pump, can get wider. The PR interval, which is the time delay between the top and bottom chambers firing, can get longer too.
Okay, so things are slowing down and widening out electrically. What happens if it keeps getting worse?
If the potassium level continues to climb, the P waves, representing the top chambers, can flatten out, become wider, and eventually just disappear altogether.
Okay.
That's called atrial standstill. The top chambers basically stop contributing electrically.
Whoa.
Yeah. And at really high levels, the QRS complex and the T wave can kind of merge together into this wide, bizarre shape. This often leads to really dangerous rhythms like ventricular fibrillation, where the heart just quivers uselessly, or even a systole, which is flatline, no electrical activity.
That sounds incredibly dangerous. Is that progression always clear-cut on the ECG, though?
That's a really important caveat. No, it's not always that neat. The changes can vary quite a bit between animals. And other factors matter too, like if their sodium or calcium levels are off, or if their body pH is more alkaline. The ECG changes might actually look less severe than you'd expect for that potassium level.
So the ECG is a crucial tool, but you have to look at the whole picture.
Absolutely. Context is everything.
Besides the heart, you mentioned weakness and paralysis. Does it affect the nervous system directly, too?
Yes, it impacts neuromuscular function, the communication between nerves and muscles. That's why you see the muscle weakness and, in severe cases, the flaccid paralysis.
Okay. Let's circle back to the causes again, maybe dig a bit deeper. We talked about pseudohyperkalemia being that lab artifact. Anything more on why those specific cells leak potassium? Is it just delayed handling?
Delayed handling is the main trigger, yeah. But it relates back to the ion pumps in the cell membranes. In those East Asian breeds, their red cell pumps seem more sensitive to temperature changes or just sitting in the tube. And if an animal has a massively high platelet count or abnormal white cells from leukemia, there are simply more cells present that can potentially break down or leak potassium if the sample isn't spun down quickly.
Gotcha. And what about the low potassium elimination cause? You mentioned kidney failure and blockages. Any other specifics there?
Sure. So besides outright kidney failure, where they make little or no urine, that's anuric or oliguric failure, anything that severely reduces blood flow to the kidneys can do it too. Think severe dehydration, shock, or even certain heart conditions like a complete heart block that lowers blood pressure drastically. Then you have the physical obstructions, ruptured bladder, or the very common urethral obstruction in male cats. And the medications are a big category. Potassium-sparing diuretics like spironolactone, ACE inhibitors like enalapril or benazepril, the antibiotic trimethoprim, NSAIDs sometimes, and even the blood thinner heparin can indirectly lead to less potassium excretion by affecting aldosterone.
Wow, quite a few medications to watch out for.
And surprisingly, sometimes severe GI issues can be linked to things like nasty salmonella infections, certain intestinal worms like trichuris, or even a perforation, a hole in the duodenum. The exact mechanisms there can be complex.
That's a really broad range.
Okay.
What about the translocation causes potassium moving out of cells? We had acidosis and trauma. What else fits there?
Right. Another one is reperfusion syndrome. When blood flow suddenly returns to tissue that was deprived of oxygen, the damaged cells can dump potassium. Same idea with breaking down blood clots, like treating saddle thrombus in cats.
Oh.
Tumor lysis syndrome is another. When cancer treatments cause lots of tumor cells to break down rapidly, they release potassium. Muscle injury, besides trauma, can also happen with certain genetic conditions like phosphofructokinase deficiency. And then some less common triggers. A severe overdose of the heart drug digitalis, using the osmotic diuretic mannitol, or even really high blood sugar making the blood hyperosmolar can all cause potassium to shift out of cells.
That's a complex list. And high intake, we said, is mostly about supplements.
Primarily, yes. Giving too much potassium orally or via IV without careful calculation and monitoring.
And the last category was miscellaneous.
Yeah, that includes situations like large fluid buildups, pleural effusion around the lungs, or ascites in the belly. The link isn't always direct, but these conditions can sometimes be associated with hyperkalemia.
Okay, that covers a huge amount of ground on causes. So, thinking about all that, who is actually most at risk? What are the key risk factors?
Well, several things increase the odds. We've touched on some already receiving potassium supplements or certain IV nutrition needs careful watching.
Right.
Using those potassium-sparing diuretics and ACE inhibitors is a big one, especially if the animal already has kidney disease. That combination needs close monitoring.
Makes sense.
Any condition causing acidosis puts them at risk. Trauma, obviously. Underlying kidney disease itself is a major factor. Lower urinary tract disease, especially blocked male cats, but also male dogs with certain bladder stones.
Okay.
Animals with very high platelet counts or leukemia might be flagged for pseudohyperkalemia, but sometimes it can be real too. And then there's the breed thing for pseudo Akita, Shiba, Jindo, Shar-Pei, though remember, not every dog in those breeds has the issue. Maybe only about 20% of Akitas, for instance. And finally, that genetic muscle condition, phosphofructokinase deficiency.
So it really ties back to kidney health, urinary tract, meds, trauma, and even genetics.
Okay.
If a vet suspects hyperkalemia based on signs or risk factors,
Right.
how do they confirm it and figure out why it's happening?
Good question. First, they'll think about other conditions that could look similar, the differential diagnoses. A classic one is Addison's disease or hypoadrenocorticism. It can cause waxing and waning GI signs, weakness, collapse. Kind of vague, sometimes looks like hyperkalemia.
Right.
And if the animal is straining to pee or not making much urine, then obviously urinary obstruction or severe kidney failure jumps way up the list.
And what about lab tests? What clues are they looking for in the blood work?
Several things. A key one is the sodium to potassium ratio. If it's low, say less than 27, it's a strong pointer towards Addison's disease. But it can also be low with bad diarrhea, acidosis, fluid in the chest or belly, even pregnancy sometimes. So it's suggestive, not definitive.
Okay. What else?
Looking for azotemia, that's the buildup of kidney waste products like BUN and creatinine. High levels suggest kidney failure, a blockage, or Addison's. High muscle enzymes, CK, AST, LEH, would point towards muscle injury being involved. And like we said, really high platelet or white cell counts or knowing the breed raises the flag for pseudohyperkalemia.
Are there other specific tests they might run?
Definitely. If Addison's is suspected, an ACTH stimulation test is the gold standard to confirm or rule it out. And imaging is often crucial X-rays, maybe with contrast dye, or an ultrasound to check the bladder and kidneys for stones, blockages, or signs of rupture.
So it's a process of elimination and targeted testing.
Exactly. Vets often use a kind of flowchart or algorithm in their heads, or sometimes literally on paper, to work through the possibilities systematically.
Okay. So let's say the diagnosis is confirmed. It's true hyperkalemia. How do they treat it? What's the approach?
The treatment strategy really hinges on two things. What's the underlying cause and how severe is the hyperkalemia right now? They judge severity based on the animal's clinical condition and those ECG changes we talked about.
Makes sense. What are the first steps, usually? The immediate things?
The immediate goal is usually supportive care aimed at lowering the potassium quickly, while you figure out and start treating the root cause. 5E fluids are almost always step one.
Which fluids do they use?
Often, plain saline 0.9% sodium chloride is the go-to. The sodium in it helps drive potassium down a bit, and it also directly counteracts some of potassium's bad effects on the heart. If the animal is dehydrated or in shock, they might give the fluids quite rapidly, but always monitoring carefully.
What about diet?
For long-term management, especially in chronic kidney disease cases, a lower potassium diet can be an important part of the plan.
Okay. And medications. What are the main drugs used for severe acute hyperkalemia?
For the really scary high potassium situations, there are a few key players. Sodium bicarbonate can be given IV. It helps shift potassium back into the cells, especially if the animal is also acidotic. The dose can be estimated or calculated more precisely.
Okay, bicarb to push potassium in. What else?
Dextrose Basically, sugar given IV along with regular insulin is another very effective way to move potassium into cells. Insulin lets glucose into cells, and potassium kind of tags along. Sometimes dextrose alone can even help a bit.
Insulin and sugar, got it. Anything else for emergencies?
Yes, for life-threatening heart effects, the drug is calcium gluconate, usually a 10% solution given IV. Now, calcium doesn't actually lower the potassium level.
Oh, what does it do then?
It directly protects the heart muscle, it stabilizes the cardiac cell membranes, and counteracts potassium's dangerous effects on the electrical conduction. It buys you time while the other treatments work to lower the potassium itself, but it has to be given very slowly while watching the ECG constantly.
Wow, okay. Calcium as a heart protector. Now, what should absolutely be avoided in a hyperkalemic patient?
Good question. Number one, no fluids containing potassium. That seems obvious, but you have to check the bag. Also, avoid fluids that might lower sodium too much or worsen acidosis or low calcium. And definitely stop or use extreme caution with any drugs that contain potassium or stop the body from eliminating it, like those ACE inhibitors, trimethoprim, potassium-sparing diuretics we mentioned.
Right, don't add fuel to the fire. Are there any other drugs sometimes used to lower potassium?
There's a medication called sodium polystyrene sulfonate, brand name. Electrolyte is common. It's a resin that binds potassium in the gut so it can't be absorbed. It can be given orally or rectally. Honestly, though, it's not used that often in veterinary medicine compared to the other treatments.
Okay. Any particular warnings or precautions with these treatments?
Yes. Kyaxalate and sodium bicarbonate both contain sodium, so they could potentially cause sodium overload, which is risky for animals with heart failure or severe kidney disease. And bicarbonate can lower the body's ionized calcium levels, so you have to be careful using it if the animal already has low calcium.
It definitely sounds like a delicate balancing act.
Yeah.
So after the initial crisis is managed, what's the follow-up like?
You have to keep monitoring closely. Rechecking potassium levels frequently, maybe every few hours initially, is key. And continuous ECG monitoring until the heart rhythm is stable and back to normal.
And for prevention?
It mainly involves being really vigilant about monitoring potassium in animals on those risky medications, especially if they have kidney issues. And if an animal needs IV potassium for some other reason, it has to be given very slowly, calculated carefully, and with frequent blood checks.
And the ultimate risk if things go wrong or aren't treated fast enough?
As we mentioned, the most severe complication is death, usually due to cardiac arrest from the potassium's effects on the heart's electrical system.
It really drives home how serious this can be.
Yeah.
Okay, so as we wrap up this deep dive, what are the absolute key takeaways you want people to remember about hyperkalemia?
I think the main thing is that a high potassium number isn't just a number. It's usually a signal that something else is going on, disrupting that crucial potassium balance. And the consequences, especially for the heart, can be really serious. So recognizing the signs early, understanding the potential causes we discussed.
And getting veterinary help fast.
Absolutely. Prompt vet attention is critical for a good outcome. Don't wait if you see those concerning signs or get that high lab result. And maybe just a final thought to leave people with. Consider how interconnected everything is. We talked about how things like medications, breed traits affecting a blood sample, kidney function, even diet seemingly separate things, all funnel down to impact this one crucial electrolyte, potassium. It highlights just how complex and intricate our pets' bodies are.
That's a great point. It makes you wonder what other subtle factors might be playing big roles in their health we don't always think about.
Exactly. There's always more to learn, and digging into these specific conditions like hyperkalemia really helps us appreciate that complexity and hopefully provide even better care for our animals.